Welcome to People. I'm Micah Mater. The medical community is still talking about new recommendations from Health and Human Services Secretary Robert Kennedy Jr. when it comes to COVID vaccines. And Dr. Jeffrey Sterling is here to tackle that and the rest of the week's health headlines. Always nice to have you here and get down to the nitty-gritty.
Yes.
Let's talk about these COVID recommendations for kids and pregnant women now. Do they make sense? What do you think about that?
I think that what we're seeing is an incorporation of some of the politics and the political will into the conversation. Hopefully this will turn out to be a distinction without a difference. And what I mean by that is that the recommendations actually say, based on family priorities and concerns, have the conversation with your doctor. If you're a child or if you're under immunized, the idea is that, well, we're not going to force you to do it, we're not going to recommend that you do it, but you still can do it. So there's a shift away from the idea that if you're of this age, you need to have it. That's not the standard that they're promoting anymore.
And do you think that it could get to the point where insurance won't cover it anymore? That could be a problem.
Well, fortunately, that was a key thing that was saved in the conversation. So we haven't gone so far away that insurance won't cover it. That's a great question to ask.
Yeah. So you think that, tell me what you think. Everyone should keep getting them?
I think it's a distinction without a difference. I think the people who want it will still be allowed to have it, but they're trying to deal with the political winds to say we aren't going to force you to do it in the name of freedom.
Yeah.
But the long and short of it is that if and when you have your conversation with your physician's still going to recommend that your child be vaccinated.
Right. Okay. Not so long ago, President Biden was diagnosed with prostate cancer. This is Men's Health Awareness Month. What should men be doing?
Men should be seeking the full complement of prevention. We talk all the time about health prevention and health promotion. And the unfortunate situation with the former president was that he was following guidelines to say that after age 70, you really shouldn't be getting tested for prostate cancer anymore. And the reason for that is that prostate cancer is actually a very slow-growing disease. And at a certain age, one thinks that your life expectancy will be shorter than the time that it would take prostate cancer to get you. But that's a relatively old consideration, and as life expectancies are increasing, that's not the case, and that's been proven to be the case with him. So unfortunately, he wasn't being tested, got a severe form of it, and now he's having to deal with the consequences of not being tested.
Is it true that every man will get a form of prostate cancer at some point in their life?
That's the theoretical considerations. There are some diseases that are a consequence of aging. The things that we always say, we always talk about percentages. So for example, at age 50, 50% of men will have an enlarged prostate. At age 80, 80% of men will have an enlarged prostate. So the expectation is there. That doesn't necessarily mean that it's going to be the thing that kills you. It's kind of like arthritis in that regard.
Gotcha. Impact of the proposed federal budget on Medicaid. That's going to be a problem. For many.
I'm shocked that people aren't more shocked and alarmed about this. The Congressional Budget Office has scored the proposal, and no less than 7 million people are going to be taken off the rolls of Medicaid.
Wow.
And
7 million, you said?
7 million. And not only that, there's a total of 11.7 million Congressional Budget Office scoring, saying that we'll lose insurance altogether. So in the name of fraud, tighter restrictions, confirming eligibility, a lot of people are about to be kicked off the rolls.
What should we be doing?
Well, at the beginning of the conversation, we should be protecting our health. It's always going to come back to that.
Yeah.
Stay ready so you don't have to get ready. But at the end of the day, now's a pretty good time to really make sure that your qualifications are in line with what the expectations are. And if you aren't going to become eligible for Medicaid, you might want to start seeking now if there's protections that you can get
alternatives.
otherwise.
Yeah,
and of course, by the way, most insurance in the United States is covered through jobs. So if you have a choice in these things, get your insurance through your employer.
Let's talk about, we have a lot of things going on about Awareness Month. We said Men's Health Awareness, now Headache Awareness Month. Let me tell you, if you get a headache a lot, you really should pay attention to that, shouldn't you?
For certain people, absolutely yes. Let me just hit it real quick for two groups of individuals. If you are older than 40 years old and you have the first headache that you've ever had, you need to show up to an emergency department somewhere.
Really?
And there are reasons for that we won't go into, but new headache,
just go.
Age 40, just go.
Okay.
And the second thing to consider is that if you ever have the worst headache of your life, regardless as to whether you have a history of headaches, come see me or somebody else in an emergency department somewhere.
Yeah, because something needs to be done.
Yes.
CPR and AED Awareness Month.
If there's one thing that I could tell the audience, You should know CPR. If there's
Yeah.
one skill I could give everybody, save a life. The life you save may be your own. And by the way, I said this as far off as 15 years ago. If there's one piece of medical equipment that I want you to have in your house, it's not necessarily a Band-Aid. It's an AED machine.
Oh, really?
These things tell you how to make it work so that you can save somebody's life. And once again, it's better to have it and not need it than need it and not have it. It's not a very expensive tool, but it is there specifically for the purpose of saving somebody's life when their heart stops.
A lot of public buildings have it. I know we have
Yeah,
one here at
absolutely.
WGN. Yeah. Cannabis and heart health. Every corner has a cannabis shop.
Yeah, but the more people use stuff, the more research is being done and the more we're going to discover.
Okay.
So we're not at a point where the medical consensus has established that this thing is as risky as, say, alcohol, but the evidence is starting to pile up that there are indeed heart of consequences to cannabis in any form, inhaling, ingesting, et cetera. So we will continue to keep an eye on that, but this is not the panacea without side effects that people once wanted to pretend that it is. So
But
let's
everybody
just stay
says it's
tuned
for
on that.
medical use. It's for medical use.
Well, there are about 26 different medical indications for that. So once again, we always talk about these things in terms of balancing risk-benefit ratios. If you're getting treated for it, then we don't worry about side effects when there's a life threat that needs to be addressed in
Gotcha.
real time. But for those that are using it casually, you really have to pay attention to the fact that this is not benign. This is something that could have long-term consequences for people that are all-day, everyday casual users, and there's a lot of those folks.
Yeah, a lot of people out there doing things like that. So right now, your main thing is to pay attention to your health, but that's something that people don't really think about it all the time. They should, shouldn't they?
I don't. Maybe I'm just different that way, but I
Yeah.
really don't understand why.
Well, you're a
not.
doctor,
Because
that's why.
No, it's not that I'm a doctor. It's just that nobody's best day of their life was on a day in which they were sick.
Yeah.
Nobody, once they became successful, was able to enjoy it unless they were healthy. So you can do more things at once. You have to prioritize his health the same way that you prioritize the other pursuits in your life. So yeah, that's what this is about. It's not just longevity of life; it's quality of life as you go along, and that is health. Healthcare and medical care are two completely different things.
Yeah. You're working on your 9th book now.
Yes, I am.
Oh my gosh.
Yes.
So what is that about?
It's a sequel to my very first book. It's
Okay.
called Behind the Curtain, A Peek at Holiday Life from Within the ER.
Oh.
So what I'm basically doing are taking the 5 or 6 of the major holidays and telling anecdotes about stories of patients that I saw that correspond to the risk that exists during New Year's and New Year's Eve, Valentine's Day, Christmas, Thanksgiving, 4th of July, et cetera. Quite entertaining, but all true stories.
Yes, so take heed for sure. Thank you, doctor. You can find more on the work Dr. Sterling is doing at jeffreysterlingmd.com.